Myself, hello everybody. My name is Alejandra and I have been part of the Aerofit team since last year. And today we have a very special guest with us. This is Mike. Mike, I think that you want to introduce yourself.
I'm a fairly new member here at the Aerofit family, just starting out this year. My background is in exercise physiology and sports science, and I come from predominantly a rugby background. So I'm excited to discuss heart rate variability with you guys today.
Yeah, that's great. Okay. So Mike, I think it's time for us to get started.
Yeah.
So for those of you who really don't know much about HRV, just let's briefly tell them what is HRV.
So everyone knows about heart rate, so this is how often your heart beats, but heart rate variability is actually the time between those beats. And this varies a lot, and this is directly related to the nervous system and how ready you are to participate in physical activity or stress again. So a weird thing is the higher this is, the better it is. So unlike heart rate, the higher of this, the better it is.
Exactly. And I'm sorry, I'm going to interrupt you for a second. For those of you who are interested, yes, there will be a recording and we will have it in our YouTube channel. So stay tuned for that.
Yes.
So exactly. So it's kind of the opposite because you would assume your heart rate needs to be, the lower the better, but it's the opposite with HRV.
Exactly.
And what are the benefits of having a higher HRV actually?
Well, a higher HRV is usually related back to cardiovascular fitness. So cardiovascular meaning your heart, lungs, and the blood circulating your body. So this actually is an indicator of how resilient you are to stress and how ready you are to partake in another form of physical activity or be able to function better on the daily basis. So how well you're sleeping, how your nutrition is, pretty much how your body is over everything.
Exactly. And as your heart is also connected to your lungs and to your nervous system, basically, as you have a high HRV, it means that it has a good impact on your recovery because you can just switch from parasympathetic to sympathetic and just go really, like for instance, when you're sprinting, you can go really fast for the next sprint sooner as you have this ability to go up and down faster.
Yeah,
right?
And just circling back, parasympathetic and sympathetic nervous system. So parasympathetic, you may know it as the rest and digest. So this is when you're chilled out. This is usually accredited to getting the carbon dioxide out of your body, where sympathetic is your fight and flight. So when you're really excited, going for that sprint and then coming back into that parasympathetic nervous system.
Yeah, exactly. So basically it means that you can adapt to whichever situation you have in your environment. And this obviously has a big impact on your sports performance, but also in your recovery in many other different kind of health related situations, right?
Yeah, exactly. So all situations, anything from going to the gym, participating in sport, stressful day at the office, or even at school. So
yeah, exactly. And can you tell us a little bit more? Now we know that our heart is connected to our lungs and to our nervous system, but what other factors have an impact on your HRV?
So of course the obvious one, exercise, eating healthy and staying hydrated. So essentially we are what we eat. If we eat healthy, exercise regularly, we're going to be fitter, healthier heart and lungs. Yeah. But then there are also some negative effects such as alcohol. Drinking alcohol can actually affect you up to 4 days after you have consumed alcohol. So a big weekend can last until a Tuesday. Mm-hmm. But then also,
well, yeah,
there you go. So be careful with that one. And then there's also sleep. So if you're sleeping at a regular time, then you're going to get into a better rhythm, which allows your sympathetic nervous system and your parasympathetic nervous system to be more intertwined and work better.
Yeah.
And of course, simple things such as being exposed to natural light, as well as taking a cold shower and being mindful.
Yeah.
So really thinking about your body, but then the big one, breathing.
Of course, breathing. And breathing, actually, there are many studies and there's a lot of science on the impact of breathing exercises on HRV, which is curious because, hey, we have a device that works on your breathing.
So we thought, how can we interact a breathing device with HRV, which is something we've been working hard behind the scenes on. Yeah. And we're really happy with how it's going.
Yeah, exactly. So can you tell us a little bit more about this role of breathing in your HRV?
Yeah, so breathing can activate the two sympathetic nervous systems that we talked about.
Mhm.
So of course within RMT breathwork, you can really focus on each of the nervous systems. So if we have a program that allows more oxygen to come in, more carbon dioxide to come out, you're going to fall into that rest and digest parasympathetic nervous system.
Yeah.
You're going to be more chilled and recover faster.
Exactly. So via vagus nerve activation, basically you can control also your heart rate and you can control your breathing. Sorry, the other way around. Your breathing controls your heart rate. So in that sense, by controlling your breathing, you can also increase your heart rate variability.
Yeah, so the vagus nerve is actually just a massive nerve that controls not only your heart, your lungs, it also goes up to your brain, down to your stomach. It essentially controls every single function within your body.
Exactly.
So if we can control that, we can control ourselves.
Yeah, because some people may say, oh, but breathing, how does this have an impact on your nervous system, on your heart? The truth is that all systems are connected. And remember that the vagus nerve is the longest nerve in your body. So it really, really comes across like many different systems.
Exactly. It's essentially the giant tree trunk that runs through us and all the branches come off that.
Yeah, exactly. So what many people may ask and what many people ask us is, we're going to have also, we're going to have a Q&A at the end. So we're going to highlight some of the questions that you may have, but don't worry, we will reply to your questions at the end.
I think one thing we should mention now as well is HRV is highly individualized.
Mm-hmm.
So you can't really control yours to compare yours to somebody else. So that is why it's so important to track it over time. So you can see how it is on your own, opposed to looking at your friends who may be higher or lower than you and think, they're a lot fitter than me. But really, it's super individualized. So keep that in mind while tracking HRV.
Yeah, exactly. Thanks for mentioning it. Yeah, exactly. You have to really, really keep track of your own progress regarding HRV and obviously breathing as well, but we will get to that later on.
Yeah.
So some people ask us, okay, and which are the best sessions or which program should I follow if I want to increase my HRV? Well, the truth is that all of our programs can help you increase your HRV, but some of them might be better than others, especially the ones like if you go to our app settings, choose your goals, and you select general well-being, there are two programs that will focus on your parasympathetic nervous activation and therefore will help you increase your HRV, which are recovery and stress. Those are the two programs. And in terms of sessions, everything that's related to stress, to relaxation and revitalization as mindfulness, control, circle, concentration, those are great to work on your HRV, right?
Yeah, so the thing that actually makes you sit down and control your breathing more, be a bit more mindful of how you're breathing, all of these are actually going to have a really good impact on your HRV.
Also, for those of you who did not know and already have an AeroFit, now AeroFit can integrate your data from Apple Health. That means that if you track your HRV and your sleep with Garmin or with Apple or anything that can be read in Apple Health, then you can have it integrated into your AeroFit app. You just need to go to settings, third-party apps, and then Apple Health. You click it there, and then you will have in your section called statistics, then you will have both data for your from your breathing training and from your sleep and from your HRV, all in one place, which is our AeroFit app.
And this is a huge benefit because you can see are certain programs helping with the HRV.
Mm-hmm.
It's the timing of when you're using your AeroFit benefiting your HRV. Are you using it as a warm-up or a recovery tool? So it gives you a bit more flexibility on how you can use our product to benefit you overall.
Exactly. So basically, you can see whether your breathing training is having an impact on your sleep, your HRV, your recovery, and then it's wonderful because you can really track all your progress on many different levels.
So you can tailor make everything to suit you on an individual basis, which is a huge benefit.
Yeah, exactly. No, Mike, I think that we're going to have some time for a small Q&A. For those of you who are interested, you can just
Fire away.
fire away. All the questions that you may have on HRV, on AeroFit, we are here for you guys. I think that one of the questions was whether depression and certain mental health disorders had an impact on your HRV, and the truth is that yes, it can.
Yeah.
To a certain extent, but yes, it can, because it's all connected to your nervous system. And in fact, some science points towards the fact that mental disorders can decrease your HRV. So yes.
And another thing to be aware of this is other medications that help with depression and stuff can have a impact on HRV. So if you are thinking your HRV is fluctuating a wee bit, speak to your doctor, see if they have any recommendations about the medication you're on or your condition. As we know a little bit, we're not qualified to talk about that.
Yeah, exactly. That's also like a good thing to mention. Always talk to your doctor first. Someone says, I have the AeroFit Pro. I can seem to find the setting to connect my Garmin watch. You cannot directly connect your Garmin watch. You can integrate your Garmin data into Apple Health, and then we can integrate Apple Health data to your AeroFit app. You can just, if you have a premium subscription, you can go to settings, choose third party. Let me just see if I can
Double check.
show you here. No, if I can show them
Yes.
in our, I'm not sure if you can see here.
You can see it, okay, I think we can go.
Okay. If you go to settings, in here, you select third-party apps, account, third-party apps, and then you select Apple Health. Yeah.
Yeah, so,
And then it reads the data from your Apple Health. Yeah.
so there's a question here. At what time is the best to do the breathing training if you want to use it for a high HRV? This?
Well, I think it's regardless. I mean, whenever it suits your breathing training, I think that that's
Yeah.
not.
And I think that it really depends on your goals from the AeroFit.
Yeah.
But if you're using it as a relaxation, revitalization thing before bed, for example, I think that's a very nice time, because the side effect of breath training at night is you're going to get into a deeper sleep, and sleep is a massive impact of HRV. So in the evenings, I think would be a great time.
Yeah. If you're doing the relaxation and revitalization modules, for sure, the evening is a great time, or the late afternoon.
Yeah, something that puts you on a routine that allows you to think, I need to do this, I'm going to chill out now. That will have a positive impact on your HRV.
Okay. And there's a question, Pablo, are there specific AeroFit workouts targeting improvement of HRV? Yes, as we mentioned, like everything that's related to relaxation and revitalization. So the sessions called Control, Mindfulness, Circle, Concentration, those ones are great. And also because they focus on longer exhales. Here someone says, I don't have Apple Watch nor Apple. That is coming. Like, we are expecting to expand this to Android as well, to those who have like an Android device. So our apologies, but this is a great feedback for us, and this is definitely coming in the future. Yeah. We have another question. Alison, is there an update coming for the app? I haven't been able to log in for a while. Yes, Alison, thank you so much. Yeah, we have an update coming, and we just recently had an update. So if you send us an email to support@aerofit.com, I will show you step by step exactly what you need to do in order to fix that issue. So just basically send us an email, and I will help you log into the app again. Not a problem. Okay, so when we say recovery, we're talking more about like sports recovery. Yeah, basically like sports recovery, and maybe recovering from maybe lung diseases. When we talk about immune response, we're talking more about your immune system per se. So not only lung diseases, but also like
Allergies,
infections,
yeah. Allergies and stuff like that.
allergies.
Yeah.
Um,
And someone's just asking about why we're discussing apps. It's because of the new integration between HRV and our product. So we're just allowing people to see how they can relate their HRV and our breathing within our app.
mhm.
So that's big news coming out of us. So we want to help people understand the benefit of it.
As an athlete recovering from COVID, what is the least strenuous beginner program? Okay, actually, Jeff, we do have a recommended setting for COVID. So again, if you send us an email, I will show you the program that we specifically have if you're a beginner recovering from COVID, because we have like some special tricks for you. We have a few recommendations from physiotherapists for your particular case. Again, if you send us an email at support@aerofit.com, I will be happy to provide you with further information. Yeah. Will a program come about to use the Aerofit while moving? Not for the moment. We do not recommend regularly. We do not recommend respiratory muscle training while exercising, because it should be a workout per se, right?
Yeah. It's like anything, any type of muscle training. So you wouldn't train the bench press while on a bike. So while you're training your diaphragm, do it separate to your cardiovascular training. That way you get the optimal results out of the training program.
Yeah, exactly. That's a great point. Yeah, that's a great point. Are there any contraindications? Not from our end. I mean, we have users from different age ranges. We have people recovering even from lung cancer. However, if you do suffer from a special condition, please always consult with your private practitioner, with your medical team. But so far, we don't have any contraindications.
No, and this is especially if people follow the recommendations of the app. So it's been programmed to be achievable for everybody. So stick to the guidelines and you'll be fine.
Yeah.
But if you are hesitant, as we said, reach out to your private practitioner and discuss your concerns with them.
Yeah, exactly. So where would I see the HRV data? Thank you, Liz. So actually, I'll show you again. Let me show you. If you go to activity, this part down here, you have activity. If you already integrate your Apple Health data, then you will see first the results of your breathing training, and then down you will see all your sleep and HRV data. It is sometimes difficult, and breathing with the nose happens automatically. If the breath hold, okay, so you do what you can. Sometimes if you're struggling with the exercises and you need to occasionally just breathe through your nose, it's fine. You will eventually adapt, and your system will eventually adapt, and you will not need to do it with time. Sometimes people feel like they need to put a clip in their nose just to prevent them breathing through their nose. However, this is not necessary. It's fine if you need to take a breath through your nose and kind of cheat while you adapt at the beginning. That's okay.
And I think that just comes from our desire to breathe. So we have something blocking our mouth. We want to breathe out of our nose. So over time, you will adapt and become better at this, which is a really big benefit of the Aerofit as well.
Yeah, exactly. Do we have any more questions? Whichever question you want.
And of course, if you have any questions you don't feel like discussing on an open forum such as this, feel free to email us.
Yeah. Is it okay to close your nose with your fingers while doing the exercises? Although unnecessary, it is completely fine if you close your nose. Completely fine.
When I first started training with Aerofit, I did that because I couldn't control myself.
Yeah, we all do at the beginning. Yeah. For a competitive athlete, how should one distribute the breathing sessions? Okay, so this is a great question, and we usually recommend you to train twice a day. So the best results are are shown, or science has proven that the best results come when you train twice a day. So basically, it's better to have 2 5-minute sessions than 1 10-minute session, if that makes sense.
Yeah, and also a lot of the athletes I work with the Aerofit, they'll use it before they train or competition, and then once again as a recovery tool. So they use it as a warm-up and a recovery. So 2 5-minute sessions, as Ali mentioned, and yeah.
Yeah. Breathing programs are set to everyday training, such as 3 trainings. Yeah. If you completed the training, can you train more? That is a question that we usually get from athletes. You can, but you shouldn't train more than 15 minutes because your muscles can get overly fatigued. So we usually do not recommend you to train for more than 15 minutes, please.
Yeah, if you are an athlete, the way to think about it is you're training for a running race. How hard are you willing to push yourself in training before you lose functionality and the benefit of the training? So if you want to look at adding an extra training in, I'd recommend just starting with 1.
Yeah.
Seeing how you feel the next day. Yeah. You're a wee bit tired in your diaphragm and lungs. So take it slow if you're adding more in.
Exactly. And regardless, I mean, you can add 2 sessions in the morning and then 1 session in the afternoon, 1 session in the morning, 2 sessions in the afternoon. But all in all, it should not be over 15 minutes. Yeah. Can you say how? Oh, how does HRV relate to heart rhythm? That means to heart rate, I assume. So
yeah, so heart rate is the amount of beats per minute. So if you have a heart rate of 60 beats per minute, you can assume 1 beat per second. However, HRV is the time between them, so that it could range from 0.9 seconds to 1.1 and somewhere fluctuate in there.
Yeah.
But I think, so are you referring to heart rhythm, such as like an irregular heartbeat, or?
No, I think that is more like heart rate.
Okay, perfect. Yeah, so they don't necessarily relate to each other. However, a lower heart rate will generally have a higher variability because of the increased time between the beats.
Yeah, exactly. So is it recommended to train twice a day? Yes. Yes, it's preferable to just train twice a day instead of having the 3 sessions at once. Yes. Since the suggested schedule in the app is 3 sessions per day, and the first one is like a relaxation session. Okay. So Pablo, I think that you can send us an email again, and I will guide you through that. I will guide you through it in your personal case. Yeah. The time for each session is fixed. Can it be reduced? Yes, it can. If you go to Discovery, and you select a session, then you can select the duration of the session. Yeah. Does the app have reminders? You can activate your reminders if you go to settings. You can activate your reminders. Yes, Mario.
I literally just felt my phone vibrate then, and that is because it is, coming up 8:30, which is when I've set mine for.
Uh-oh.
So I'm going to do mine before I head home.
So, yeah.
So they are very, very handy.
We both need to train.
Yeah.
Yeah. Yeah.
Any more questions coming through?
Just please remember that if you have additional questions and particular cases, you can always write us an email to support@aerofit.com, and I will make sure that all your inquiries are answered and that all your requests are listened to. So thank you so much for being with us today, and we hope that you have a wonderful rest of your day and a great breath training journey.
Yes. Thank you very much.
You'll be also seeing Mike very soon. Thank you, everybody. Have a wonderful evening, afternoon. Bye-bye.